Why? Because of the variable shape, size, and position of the LR cartilages. Why? Because of the impact of surgical techniques on the tip support. Also, because of the thickness, the texture of the skin, and the wrap of the subcutaneous tissue. And because no technique by itself is adequate to correct the tip of the nose. I really like the tripod concept. Why? Because its principle is always to maintain and increase the structural integrity of the tip. So in this tripod concept, the lateral crura and the medial crura are the extremities, and lengthening of the medial crura causes a rotation of the nasal tip upwards and a greater nasal tip projection. And shortening of the medial crura causes counter-rotation and deep projection of the nasal tip, as you can see in the graphic. But we have to consider some aspects at the time the patient comes to our office, because with a very good palpation, we can see the type of the skin and the strength or weakness of the LR cartilages. And also, it's very, very important to do a very good photographic session with the patient. So this is the only way that we can know what is inside the mind of the patient, and also if we can feel the expectations of this patient after surgery. Once we do all this examination, we have to decide if that patient is going to need a stronger framework to fight back the contractive forces expected in the post-op period. So the selection of the correct technique is based on a detailed preoperative understanding of the patient's anatomy. So as another speaker said, we have a bunch of tools that we have to apply, but the decision of using this technique or the other technique or this tool or another tool depends on really a very detailed preoperative plan. So you can see in this slide different kind of tools that I maybe can use in one patient, but maybe in the other patient I'm not gonna use all these. So in this case, what I did in this patient, a lateral crural steel for making a very good rotation